Very good afternoon, everyone. It is an honor to welcome you all to today's webinar on the topic that is revolutionizing the modern dentistry today. It is called digital smile design and the digital workflow, right? So first, I would like to extend my heartfelt gratitude to the organizing team, that is Dentees Educare. So it is a practice management software, and really, grateful for them to organizing such webinars so that we can share our insights with fellow colleagues and students, right? So thank you for that. So and I welcome all the delegates who have joined across India, and thank you for giving your valuable time for this webinar. So having said that, so dentistry has always been a blend of science, skill, and the artistry, right? So however, with the advent of digital technologies, we have entered a transformative era where the precision meets the innovation and the patient satisfaction reaches the unprecedented heights, right? So digital smile design and the integration of these digital workflow, what you see in this picture, right? It has allowed us to shift from the traditional methods to a more efficient, accurate, and predictable approach. So today we explore how these digital tools empower us to create a personalized, functional, and pleasing smile, right? So while streamlining every stages of this dental journey from diagnosis to the final restoration. So whether you are a clinician looking to adopt this workflow or refine your current practices, so this webinar will equip you with the valuable insights and the practical applications. So having said that, we will start with the journey of digital smile design. So that is here, when you see this picture, look at the smile. So everyone smiles in the same language, right? So it is a unique feature for everyone has got from the God, right? It's a God gifted smile, right? So this we can customize, we can personalize, and we can, make it to the patient needs and desire with the help of this DSD. Those who want to change their smile, right? So we cannot proceed ahead without acknowledging the person who is behind this DSD, that is Christian Kochman. He is called as the father of modern digital smile design. I would like to show his. So he is Christian Kochman. He is the person who is behind this designing the smile. So I have just shown you a picture here. This is called as a test drive. We can say it as a test drive, right? So before any patient wants to go ahead with the full mouth rehabilitation or implant surgeries or a complete denture or even a veneer closing a diastema or a fractured tooth, whatever, if you are able to show them how they look after the restoration, really that makes sense, right? So this becomes a valuable value addition in your practice, where definitely it will help in converting these high ticket patients into your day to day practice, right? So if you can show him this is how you look pre-operatively, so this the smile what we can assure you, then definitely the chances of converting such patients will become high, right? So this is called as a digital test drive, correct? So like this, these are a few. In this today's the webinar, I will try to show you different cases, like what we have you know mm, done with this tool called digital smile design, And before that, I would like to, tell you the basics of smile design. That is, how you should analyze the smile, how to analyze the smile, and how to use the different softwares that is readily available in the market. Okay. And third, I will focus a light on the digital workflow that is there in today's market. Got it? And after that, if time permits, I'll show you how to design, how to design the smiles in 2D images. 2D images. 2D in the sense we can design these smiles using a free software like a Keynote or a PowerPoint that I will show you the insights on the of that. And few softwares like 3D like Exocad, 3Shape, uh, things like that. So that also will try to manage, right? So to focus on the basics of this smile design, I will not, take you to the undergraduate level wherein, wherein the definitions or the classifications and all. Purely, it is a practical based webinar that I'm trying to present today. Uh, so just highlight the basic features which even your software will also ask you like. Okay. So those basic things we'll discuss and go ahead with the uh, slides. Thank you. So this is the smile is a curve that sets everything straight, right? So aesthetics is a branch of philosophy that is dealing with the beauty. So before going for DSD, you should know certain basic things about designing software. Every software asks you these lines, interpupillary line. So what is that interpupillary line? It is an imaginary line passing from the center of one pupil to the another pupil, right? The yellow line, what you see here, that is called as interpupillary line. So this line has to be matched before you start designing. Because what happens if a patient has turned his head like this on the right side or a left side, okay, you can always correct the image in the software with using this simple tool that is called as interpupillary line. Next, you'll see the facial and the dental midline. Okay, there are two midlines. What is midline? Midline is an imaginary line that is passing from basically three points, that is the point nasion, point A and point B, right? So this is an imaginary line passing through these 3 points. Okay, so this is called facial midline. Then what is dental midline? Dental midline is nothing but where you ask the patient to retract, or you keep a cheek retractor and check the midline that is passing from both the central incisors of maxillary and mandible. So this is called dental midline. So why I'm telling you these two? Because the software will check this dental and the facial midline. Okay. So most of the times these two may not coincide. I think around 0 to 4 millimeter variation is common. You don't have to change the midline. Okay. So 0 to 4 millimeter is acceptable. Then the next setting, what the software wants you to know, that is facial profile, right? So what is facial profile? When you ask the patient to, you just see, look at the patient from the side way. Again, you see those 3 points, that is nation, point A and point B. Try connect all these 3 points. If the line is straight, we call it as a class 1. If it is convex, we call it as a class 2. If it is concave, we call it as a class 3. So how it matters in designing, we will see in the softwares. How to, it will definitely affect selecting the tooth shape and the size. Thank you. So this is face form. So face form, we have 4 types. We have square, square tapering, tapering or the ovoid. How it affects in selecting the tooth. You look at the chart here, square tooth, square face. What are the points to see how whether the face is square or a square tapering or a tapering, how it is. So take 2 bizygoma points and 2 biangular points. Okay, bizygoma and biangular. Connect all the 4 dots, you will see the face form. So in between, if you want to, ask certain questions, things and all, you can message in the chat box. They will connect it to me. Okay, thank you. So that is facial form. Next is smile line and the smile arc. What is smile line? Smile. See, these are very. Both the line looks very similar, but try to understand the difference here. Smile line is one that is passing from the tip of canine to all the incisors. It is passing from the tip of central incisor, lateral, and the canine. Smile arc is it is the upper border of lower lip. Okay, so that is smile arc. So when you try to make these two lines parallel, okay, then yeah, the smile will become very pleasing, right? The smile line, it can be high, medium, or low. When we call it as a high, when you are able to see more than the gum line, like if it is more than 4 to 6 millimeter of a teeth or gummy smile, you can say it is a high line, high lip line. Medium is part of a tooth or seen, okay, and low lip line is hardly 1 or 2 millimeter of a teeth are seen. So that is low lip line. Okay, low lip line, high, and the medium. So this will help us how your DST is going to affect. Suppose if a patient has a low lip line, definitely it will have a low significance or low, expectations for digital smile design, right? So this E position is very important, especially in the photography for DST consent, not for recording or jaw relation or bringing the mandible in centric, whatever. So here maximum extension of the lips, and you ask the patient to say E, and you click a photo. So this photograph is really helpful for us because there will be separation between both the maxillary and mandibular teeth. So this will help us in designing. This is called E line. What is E line? E line is the aesthetic line that is, it's also called rickets line that draws from the pogonion to the point A, tip of nose to tip of the chin. Okay, so just see the picture here. I don't have a marker. So if the upper lip is 4 millimeter behind and the lower lip is 2 millimeter, this we can call it as regular, that is class 1 profile, right? So this will also help in differentiating your malocclusion, whether it is dental or skeletal. We can call it as skeletal when the upper lip is, the more than 5 to 6 millimeter behind, and the lower lip is almost touching the E line. So then we can call it as a skeletal class 2, right? So things like that. We can also use this line to differentiate between the skeletal and the dental malocclusion. Whereas it is different with the different races as well. But as far as Indians are concerned, this E line can be used to differentiate skeletal and dental. And next is the golden percentages, golden proportion. Golden proportion, you just see the top left picture here, that is 1.6. The second is 1 and 0.6, right? So we always maintain the ratio in a 1.618 is to 1. 1 is to 1.618. So that is the golden proportion that we use to design any smile. So these are the digital tools that is there that we are going to use in the software to design the smile. Right? So that is golden percentage. Or we have one instrument called as choose gauge that you can see in the last picture here, choose gauge. So that is also that will help you to evaluate in the clinical situation. You can straight away check it in the patient's mouth because that choose gauge exactly opens in golden proportion. Okay. And the other things like a red proportion. Red proportion is, this is the ratio between the width to height. The ratio between width to height. For example, if our teeth are short, we can say the right proportion is 80%. If the teeth are normal in length, it is 70%. That means 70 portion is height and 100% is width. Okay, so that is the ratio between these two. It's a 70, right? That is 70% normal. Tall teeth can be 62. 62. That means width is small and the height is small. Width is small and the height is small. In 80%, what happens? The width is 80% and the height is 100%. Okay, so usually when we design, we select a 70 to 80% for designing the tooth shapes. So with this, we analyze the smile by the upper lip position, height, whether it is average, high lip line, low lip line, and all, and check the parallelism of this maxillary incisal curve with the lower lip, that is smile line and the smile arc, and the relationship between the maxillary anteriors and the lower lip, number of teeth that is displayed in a smile, and midline relation of the central to the philtrum, and the interpupillary line, midline of the face, midline of teeth, midline of the lip symmetry, profile, negative space, buccal corridor. So with this, with all these parameters, we design the tooth size, shape, and the position. Okay. So dental analysis, check the width and height of the existing teeth, proportion of the existing teeth, the parallelism, axial inclination, rotation, the malposition, gingival characteristics. So with this, we design according to the patient's age, sex, and the personality. We use dental photography. This is a very important tool in smile design. That is dental photography for 2D smile design. Nowadays, we are able to do 3D as well. Routinely we are using the intraoral scanners. We have STL files ready, so we can use the 3D designing softwares as well. But basically, 2D designing is critical before we go for three-dimensional design, right? So with that, we do DSD, that is digital smile design, and oral health is really, if a patient is not maintaining the oral hygiene, everything whatever we do will go waste, right? So educate the patient regarding the oral health. Okay, and the last one is shade selection. After doing everything, if the shade is not matching, definitely it's a failure, right? So take care of these 5 factors here, that is age, sex, and the personality of a patient. Use dental photography, digital smile design. I'll show you different softwares and the gadgets that is available. Educate the patient's oral hygiene and shade selection, right? Yeah. With this, I'll just show you how a modern practice looks like in present era. Yeah. Hope you enjoyed the present day practice, right? So they used all the latest gadgets that is available in the market to give the best resulting smile, right? So before we go ahead, I'll just tell you a few things about the dental photography, because without knowing a proper photography, you can never do designing. I'm telling you, you can never do designing without knowing the proper dental photography. See what happens when you click a photo with a mobile and versus a DSLR, definitely it will make the hell lot of difference, right? So there is a difference in, the sensor size and the image quality between the mobile and the DSLR photographs, right? And there are, when you compare these two with the mobile as well as the DSLR, there are lots of, difference, right? So the mobile phones, they have a fixed lens, right? Where the DSLR, it has a wide range of lenses, so that will give you a real depth like feeling, correct? So we suggest for any digital smile design, we suggest to click photographs with the DSLR. So that is best. If it is really, absolutely not possible, even you can use a mobile phones, but you should know how to use them. How to use them, because when you click a photo, patient's head should be fixed. Patient head should be fixed in the sense it should be exactly in the center, right? If a patient rotates his head on the left or on the right, the image will get distorted, correct? So and the resulting designing will also vary. Correct. So that is why you need to have a good photographs. I just want to know, like, just a minute. Sorry. Are you able to hear me properly?
Yes, yes, doctor. Yes, doctor.
Okay. Can I continue?
Yes, yes, you can continue.
Thank you. Done. Yeah. So so we suggest to use the DSLR with a good flashlight. Okay. Flashlight really matters, whether it is a dual point flash or a ring flash or a head mounted flash, whatever. But thing is, you need a proper lighting. So lighting will really make the difference in photography. Okay. So Christian Coachman has given this uh, outline for those who are interested to have a dental studio in the setup. You can see this, the horizontal line here on top, that is 2 meter, that is a wall. So one wall is white in color and the other wall is black in color, right? So whatever the contrast you want, you can use the wall. And these are the LED lights, flashlights, that is black color one. One, two, three, four, right? So they have fixed these lights in front. This is the patient here, orange color dot, patient. In front of patient, there are two camera, and exactly in the perpendicular, your camera is working, right? So this is how uh, dental studio setup planning is given by Christian Kochman. And now, what are the photographs you need to have before for a DSD? This is a template. One is the normal smile, one is the retracted smile, okay, and the profile image, and 12 o'clock position. That is number 5 is 12 o'clock position. That means the photo is clicked from behind like this, 12 o'clock, and you need a one occlusal photographs. So these are the 6 basic photographs you need to have for DST, right? And now presently you can have only 2 photographs also. If you really just want to show how they look, if you just want to show them how they look, you even if you have 2 photographs, that is one smiling and the one retracted, is more than enough. Okay, so this is also enough. So when you click a photo, there are certain settings in the DSLR, like the ISO setting, right? There are 4 settings: ISO, aperture, that is f-stop, and your shutter speed. Okay, so try to keep ISO at 400. Okay, 200 to 400. So that will give you optimal results. Okay, so try to keep for intra or for in the dental studio photographs, ISO keep it at 200 or 400. That is enough. And the shutter speed that means how much up to how much time your shutter is going to open. Okay, the shutter speed keep it for intraoral photography. Keep it at one is to sorry 1/125 fifth of a second. 1/125 of a second. So that is enough shutter speed. See, if a shutter speed is more, that is 1/2, the photographs will become very bright. Okay, so if it is 1/150 or 125, you will get an optimal lighting like this, right? If you shake a image, it will look like this, correct? So in the aperture is how much light is going to enter in the sensor, right? So aperture for intraoral photography, you keep it as f12. For extraoral, for extraoral with the distance, you can keep it at f18. Okay, aperture. See, look at this aperture. If it is more, it will be like a portrait image. If it is 22, you'll get a optimal image like this. And the flash, that is through the lens setting. Through the lens setting, you can keep it at 1:32. That is enough. 1:1/32. Okay. Whether you use a ring flash or a dual point flash, it will definitely help you in good photography. But basically, for digital smile design, they recommend dual point flash. Okay, that is good. For endodontic practice and pictures like that, you can use a ring flash, right? So here the less flash, more flash, and this is optimum flash. So these things you can check when as and how you start using the camera, right? You'll learn all this when you start using the cameras. So that is DSLR photography. So with this uh, a brief introduction of photograph, we can continue with using the contrasters. So you should know how to use the contrasters in photography. See why I'm telling you all this? Because without a very good photograph, you cannot design the smile. If you just send very vaguely clicked photos, like randomly clicked one, the design, the person who is working on design definitely will not be able to correlate things, right? So even if you along with the dental photographs, if you use these contrasters, definitely it will add value for your photograph. I'll just show you one small video how to use these contrasters in dental photography.
Oh, sorry to interrupt, doctor. I think it's not audible. The video is not audible.
Video is not audible. Okay,
Yes.
then shall I explain along with the video?
Yes, yes, you can, you can.
Yeah, sorry. Okay. So while using these contrasters, so these are the different types of contrasters that is available along with your photography kit what you get for the intraoral mirrors, right? So these contrasters can be bent like this, okay, to click different photos like this. See, if you want to click the frontal image of a teeth, you can block the intraoral structures that is there behind the teeth with such contrasters. So this will definitely help in appreciable design that is on the image, right? It looks like this. And we have different types of contrasters like this, which can